Yes, hello. Happy midweek, and we are back again here live for In Harmony COVID Conversation. Today is October 21. We are already in the seventh month from the COVID quarantine. So, medyo matagal-tagal na tayo, no? At medyo na din we are going on the third month in since we started our COVID conversation, and we would like to give our thanks to all our supporters, our followers of this COVID conversation. As you know, In Harmony used to be a magazine show by Hope Channel Philippines, but because of COVID, it has restrictions of movement, but stories are out there, so we opted to utilize this blessing of the internet, and that is why we have this COVID conversation. And this afternoon's episode is another extra special episode. We were so overwhelmed by the turnout of the reach of our poster. We've reached 20,000 for the poster, and we are overwhelmed. My heart actually is overwhelmed. Balance siya, no? Medyo nakakatakot kasi we saw the need of everyone talaga on really, parang malaki yung question mark kung paano ba talaga ang breastfeeding in the time of COVID. Pero at the same time, we're happy because we are able to deliver the message to you. And this afternoon, we have two empowered women with us. You've seen from the poster, we have Ma'am Richelle-Gerong, a good friend of mine, who's a COVID survivor. And of course, Doc Jessa Sareno, a Pediatrician-Neonatologist from Reyna, Xavier University Hospital. So, antay-antay tayo dyan, no? We'll have a conversation with them in a short while. If you have questions about the breastfeeding process, so you please feel free to comment below and we'll read it for you. Okay? So as we go live, kasi nga that's the usual, you can send in your questions, post it down below, and we will read it for you. All right. So this is our episode. We are also live, by the way, via the simulcast at USTP FM DXGG 104.3 dyan sa Claveria. Hello, DJ Ayan. Thank you for your support sa paano ba siya itagalog? Pag-send through the airwaves ang ating broadcast, no? Kung hindi man siya ma-reach sa Facebook Live, meron din tayo through the radio station of our university, USTP FM DXGG 104.3. DXGG FM. So, my name's Angel Escuna-Cullera, and welcome to In Harmony COVID Conversation. So, let's begin this program with a verse. Okay? Our verse this afternoon is found in, okay? So, we have, ayun. Our memory verse is found in Isaiah 41:13. It says, "For I, the Lord your God, hold your right hand. It is He who say to you, fear not, for I am the one who helps you." So yun, no? Most pressing siya, ano ba siya na verse sa atin ngayon, no? Comforting masyado, no? Na we are still in the dark with this COVID. Pero there's a promise of God in Isaiah 41:13 that says, "Fear not, for I am the one who helps you." And that verse would also be reflected in the story of our mom this afternoon, si Richelle. No, so, of course, patuloy din tayo sa ating paalala na kasi, as I said, we are still in COVID. Huwag po natin siyang kalimutan that meron pa din tayong responsibilidad para ma-end natin talaga tong COVID. Para finally, we would win the fight against COVID. So, huwag natin kalimutan, palagi tayong magsuot ng mask. Alright? Properly. Hindi lang siya kailangan na nakasuot pero nasa chin. So, dapat nakakover yung nose and mouth. Kasi nga dyan yung entry points ng virus. And of course, now may added na siya ng IATF. yung face shield. So, and of course, practice proper hygiene and let's maintain physical distancing of up to 1 to 2 meters apart. So, no, hindi siya ibig sabihin na okay, naka-face shield, face mask naman ako, so okay na kami chami-chami. Hindi po ganyan. Okay? Kasi po, dito sa Cagayan de Oro, paalala lang namin, starting ng October 5, andyan na po yung ordinance na nagre-require ng face shields sa lahat ng mga public spaces, no? Uh, sa public spaces, sa public market, sa malls, kung saan pa kailangan madaming nag-convert ng mga tao. So, reminder lang, is 2,000 pesos pag kayo ang nakita ng ating mga task force na hindi yan properly nakasuot yung inyong face mask at face shield. So, paano na lang? Di ba? So, remind lang tayo dyan mga kapatid, mga kapwa, mga ceremony. No? Para naman din tayo mag-post na din tayo sa kaguluhan ito with against COVID. Meron pala tayong panawagan sa lahat ng mga manunulat dyan. There's an essay writing contest sponsored by Greenergy Solar here sa Cagayan de Oro. But this is open to everyone. The story the story of our clean energy future. So ayan, maximize lang natin siya, no? Ayan siya. So the mechanics is that this is open to students aged 15 to 23 years old. The topic would be our clean energy future. What does it look like in Mindanao? Okay, so the essay should be between 350 to 500 words and submitted in PDF file in an email addressed to info@greenergysolar.ph with the subject Clean Energy Future Essay Competition with your family name and first name. And provide in your email your full name, your birthday, your school, your contact number, and the field of study if it is applicable. Deadline po nito is October 31, 2020. And let me just say, the price now is already 10,000 pesos with a solar wall lamp. Okay? First prize will get 10,000 pesos and solar wall lamp. And of course, the consolation prizes of 5 will get solar wall lamps and 1,000 pesos each. So students, ano pang inaantay nyo? Join na. Okay, send in your entry in a PDF form and do check the page of Greenergy Solar. Okay, Greenergy Solar. So, yun. No. And of course, bago ang lahat, tingnan muna natin kung sino yung ating mga kasama this afternoon. Ayan, I have to wear my glasses na talaga. Obvious na ba? Okay. Janine Kabatingan Bagayas is saying hello po. And of course, Josh is saying hello ka in harmony. And hello, Miss Hello. Yes, hello, Janine Kabatingan Bagayas. And thank you. Janine is also saying thank you, Mariel Valido Ledesma, for this. Ma'am Lorge Metante Lampon Aratna. Okay? Earl is also saying good afternoon po. And Lorge is watching. Lorge Metante Lampon is watching. Mariel Valido Ledesma. Janine Bagayas, very good ma'am. Study daan. Okay, so I believe si Janine at saka si Mariel yung nag-comment sa post namin that you watch. Janine, we're praying for you to have a safe delivery and hope that you will have a wonderful experience with us this afternoon. And Ann Miles Zarasate Gerlan is saying hello, hello, hello. Yon, no? Sa ating mga mamshies dyan at mga ka-harmony, baka pwede nyo din siyang i-comment kung saan kayo, where you're watching us right now, baka sa anong parte ng Pilipinas, because we checked kanina, we've gotten that may mga groups ng moms from Palawan and Bicol. And of course, Mother Nanays of Mindanao. Thank you so much, Miss Nadine and your group for sharing our episode this afternoon. You can, by the way, share this episode through Watch Party. Kasi our objective talaga is for everyone to be properly informed on this conversation. So, yun na. And again, I'll say it again. If you have questions, please feel free to comment below and we will entertain that. So, ano pa bang hinihintay natin? Eto na tayo. So we have this afternoon two empowered women. We are so honored that they will be gracing us this afternoon. But we begin with our conversation with this, grabe, di ko na lang, mamaya ko na lang sasabihin. A colleague, a good friend, a church mate, Miss Richelle Elisan-Gerong. Hello, hello,
Hi.
hello, hello. Good
Hi.
afternoon. And you are with Raf.
Yeah, this is
Ayun.
ito siya ang survivor.
Yes, oo. Both of you. And also you have there Raymiel. Hi, Ray. Hi,
Hi.
Ate Ray. Say hi to everyone. All right. She'll be joining us, palabas-pasok yan si Ray. Kasi tulong siya magbantay sa mami niya kay Raf. So, Rish, I see that you're breastfeeding. Wow. Grabe.
Yes.
Ganda, ganda. That's a very beautiful sight that I'm seeing right now. Pero Rish, simulan natin because congratulations, praise the Lord, you and your family, kasi your entire family, including yung cousin ng husband mo, contracted COVID. Last month
Mm.
ba yun? Or no? August? August or
Yeah,
last month?
September.
September, no? September,
Entire
September.
month.
Yeah. Pero bago yan, meron bang ibang, may another layer pa ng story dyan kay Raf. Baka pwede natin siyang ma-share because your pregnancy with Raf is extra special. Baka pwede mo siyang ma-share sa ating mga ka-harmony.
Di lang siya extra special, extra challenge din siya.
Ayun,
Kasi,
oo.
oo,
Mm-mm.
um, I've been through 3 miscarriages since
Mhm.
2017. So, every year, nawawala yung baby. So, at first, parang hindi pa kami makapaniwala. Bakit nangyari yun? Siguro medyo hormonal imbalance lang. So, hindi pa kami nagpa-check. 2017, 2018 it happened na raspa ako, na DNC ako. And
Mhm.
then, sabi ko, ano kaya to? Parang recurrent na, twice na. Pero
Mm.
hindi pa kami nagpa-check. May nagsabi
Mm.
sa amin na doctor na baka apas ka. Sabi ko, ano yung apas? So, I have no
Mm.
knowledge of it. Then, I went to the doctor and then, to a high-risk doctor and I was given list of laboratories. And so, syempre,
Okay.
hindi siya basta-basta. I mean, hindi mura yung pagpapatest. So, sinantabi muna namin, then I got pregnant. So, that's the third
Mm.
time. And apparently, yun, nawala pala rin yung baby. So, 3 miscarriages and that's the time na medyo alarmed na kami.
Mm.
Early this year, January,
Mm.
um, nag-positive na ulit ako. And then I found out na yun, pregnant. So sabi ko, it's
Okay.
up to us whether I want to what do you call this? Gusto namin mabuhay ang bata or hayaan na lang namin. So, we
Aha.
felt guilty by not doing anything. So, what we did is like, we really went to the high-risk doctor, went through the diagnosis and then the treatment. And I was categorized as an APAS or meron akong anti-phospholipid antibody syndrome. So, yung mga kaapas mami diyan or sisters, you know what we are going through. Kasi hindi siya,
Mm.
yeah, if you can see sa picture, those were the
Oo.
injections that I had to take daily. As in, like, I should not miss even a single one.
What
So,
was the
and that's,
injection for, Rish? Para
that
saan ang
is,
injection?
that is an anticoagulant, yung parang hindi siya magbuo-buo, magkaroon ng clotting. So it prevents the clotting, and that's just one of the medicines that I took during my
Mm.
pregnancy. I
Mm.
I think I took more or less 7 to 8 medicines, including that in a day, on a daily basis. Until
Wow.
prior the day that I gave birth. So,
Aha.
masakit siya and then syempre, I mean, ako mataas ang tolerance ko sa pain pero when it comes to injection,
Oo.
hindi ko gustong ini-inject ako. At mind you mga viewers, ini-inject
Mm.
siya hindi sa kamay, hindi sa paa, ini-inject siya around your navel. So, around your pusod.
For how many months ito, Rish?
From the time na nagbuntis ako until bago ako magbuntis, then after I gave birth, I have to continue it for another 1 month.
Oh no.
So,
Oh my gosh.
ganun siya. And then,
Oo.
limited ang kilos, of course. And then, ang dami mong tinitake na medicine that you should not miss. The
Mm-mm.
compliance should be higher. So, imagine, January, February, March, April, 9 months. I took
Wow.
those medicine just to keep the baby.
And this is March na nag-COVID na siya, di ba?
Oh,
Woo! Challenging, challenging. Pero Rish, eto pa. Sige, fast track tayo. So si baby okay na. Ano ba 'yon? Weeks bago ka nag-give birth, nag-lessen na yung ano mo, yung tawag nito. Pag-inject mo,
medicine.
may tinanggal sa'yo ng mga medications.
May tinanggal lang na dalawa, pero
Mhm.
the injection still continues. I think dapat until September 5 pa siya, pero napaaga
Aha.
ako ng konti. Oo.
Okay.
Oo. So,
Yun.
hindi, ang last na take ko siya is yun that night na, the night before I was brought to the hospital. Dalawa
Okay.
lang yung
So, eto
nawalang
na nga.
medicine.
Dalawa lang. Pero ito na nga, you were saying na about na dinala ka sa hospital.
Mm.
Prior ka dinala sa hospital, you experienced chills or fever. Correct?
Oh, the night
Oo.
before.
The night before. But that was
Pero that
because, not
weekend,
oo. Pero that
that
wasn't
weekend I
in your,
felt na,
ano, oo. Kasi nanganak ka Sunday morning, Monday morning. Early
yes,
morning.
Monday
Tama, tama.
afternoon.
Monday afternoon. Can you walk us through anong nangyari nung ano para ano lang paano paano mo nakuha ano na you're a COVID suspect kaya kanila sinwab
Okay.
you were subjected to swab.
Because I went to the hospital, meron akong lagnat. Oh,
Okay.
so that's the number one indication. Like, parang hindi normal sa buntis na magkalagnat ka. Especially, hindi naman, I mean, hindi, basta, especially ngayon, ang lagnat kasi is an indication of COVID, di ba?
Okay.
So,
Oo,
yun,
oo.
that's a big factor para iswab ako. Pero prior to that, that weekend,
Mm.
'di ba dito sa Cagayan de Oro, ang 28 is a holiday, 'di ba?
Mm.
28 was a holiday. Doon nagsugod, that was Friday. So Friday, medyo iba na yung pakiramdam ko. Like, I was under the weather. So, ay sige,
Mm.
parang feeling ko napagod lang ako all throughout the week because as you know, meron tayong hinahabol na deadline kasi 26 we should have started our classes. So, we
Oo.
burned the midnight oil that week. As in, I
Oo.
think sabi ko, exhausted lang ako. But then, sa feeling ko parang it's just a common ano ba, it's a common exhaustion. So 28 Friday, medyo
Mm.
malamya yung pakiramdam ko. Pero I still did the same thing. Nagluto ako, naglinis ako, nag-alaga ako sa bata. Normal. Pero the feeling, I've been under the weather. Saturday, still I've been under the weather. Pero that
Oo.
evening, meron ako na feel na parang consistent pain. So sabi ko, "Hey, teka lang,
Okay.
parang
Oo.
contraction na 'to." So when I got the
Oo.
app, yung application, ang interval niya is 12 to 15 minutes. So since I have my first child na, I took it as my
Oo.
parang reference. Hala, medyo bumibili siya, so
Oo.
nag-text na ako OB ko na medyo ganito na. Pero that evening din,
Mm.
mga around madaling araw, siguro around 3 AM or 2 AM, nag-chills ako. But then I accounted it, so sabi ko, baka sobrang lamig ng aircon. So, tinurn off ang aircon, nawala yung chills ko. Tapos naglagay ako
Oo.
ng mainit na tubig, like hot compress. Pagka Sunday morning, still, I've been under the weather. Wala akong cough, ha. Wala akong, yung
Oo.
sipon ko, hindi siya ganun ka-invasive. I have sore throat,
Okay.
pero it's because of my acid reflux, which I've been complaining for like 1 or 2 weeks kasi super stressed. Pero wala, ano
Okay.
lang, like, malamya lang yung pakiramdam ko. So Sunday, parang iba na talaga sabi ko, parang 3 days na 'to ayaw mawala yung ano,
Oo.
yung being under the weather. So, a friend of mine told me na mag-hot compress. So nag-hot compress ako entire day. Pagdating ng
Okay.
3:47 PM, doon ako nilagnat.
Uh-uh.
High-grade fever, 38.4.
Oh no.
Yes. So, binantayan pa namin yun. Nagpunas-punas ako. Uminom ako ng apple juice para bumaba yung weather, yung temperature. Pagdating ng
Uh-uh.
around 6:30, sabi ko, let's prepare na. Let's just go to hospital. Kasi bumalik na naman yung contraction ko ng 12 minutes to 15 minutes. And then, bumaba siya ng 7 to 10 minutes ang interval. So, medyo malapit na siya sa 5 minutes na medyo kailangan na talagang i-rush. And knowing our
Okay.
place, then of course, we decided magpa-confine na lang sa hospital.
Okay. So yun. Siya. And then if I may share then, you had when you were about to give birth, you almost parang it's also a life-threatening experience.
Mm. In the
Hmm.
sense kasi induced ako. Although sa firstborn ko induced ako, sa
Uh-uh.
second ko iba yung feeling ng induced ka like so 'di ba pa konti-konti pa lang. Pagdating kasi
Uh-uh.
ng 12 noon, after lunch or
Uh-uh.
like almost 1, tinaasan na yung
Uh-uh.
drip. Tinaasan na yung drip and then in a matter of less than 5 minutes, sobrang sakit na siya na hindi ko na kaya. Like, I think my husband can attest how I held his hand. Like, super, like, the following day, sobrang sakit ng katawan ko because, like, I was like, ano ba, nag, nag-ano ko, parang ang feeling ko ba, kailangan kong hawakan something na ano para mapigilan yung paglabas ng bata. Pero I was too exhausted to push. And I found out
Okay.
during yung nasa delivery room na ako, I found out na bawal na pala yung pundal push. So I was hoping na they could help me push the baby. Pero
Okay.
wala. I have to push it on my own. And I was just looking at my OB and then the assistant like blankly, although I can hear them, pero promise, like I was just staring at them. Even Doc Sareno, she was talking to me, but then I couldn't even utter a single word. I was just looking at them
Uh-uh.
steadily, but then behind me I was praying. And I think I tried more than 10 times, promise. I tried more than to push, pero hindi talaga lumalabas ang bata. As in, crowning na siya pero ayaw lumabas kasi I have to push hardly. Although I know na kay Reyna, pero basta ang sarap na i-push pero hindi talaga
Hindi
lumalabas.
pa siya
And then I told
lumalabas.
God na, oh Lord, isa na lang talaga. Like, hindi ko na kaya after this. Parang, it's either you take me or you take the baby. Pero just take me. Pero ano lang ha, medyo segue lang to konti.
Mm.
Prior to me giving birth, that day,
Mm-mm.
I messaged my sister, my family. We have a group chat. I told them na kung ano mangyari sa akin ha, paki-adopt si Remiel at saka yung baby.
Oh my gosh.
Like, nagpaalam na ako. So that day na nanganak ako, sabi ko, Lord, if you were to take one of us, just take me, malabas ko lang yung bata. So I made
Uh-uh.
the last push. And then it was exactly like timing na timing ang pag-cut ng ng OB ni Doc Reliquete. Timing talaga, as in timing ang pag-ano, tapos ang pagkuha sa bata, and then timing din na tumai yung bata. Paglabas na paglabas. So it's yung tummy ko at saka yung legs ko, doon na tumai yung baby. So had I delayed it for like a minute or even seconds, wala na.
Uh-uh.
Nakatain na sa loob ng tiyan ko yung bata. So it was just a perfect
Oh,
timing, like that
praise the
moment.
Lord.
And yes, and then
Yes.
good thing then, like I was panting na, like ang hirap na huminga. Ang hirap na huminga. And then I didn't know na COVID positive na pala ako nun. So isa pa yun
Mm-mm.
sa I think isa sa mga factors na ang hirap na talaga mag-push. Kasi I was catching for my breath na.
Mm-mm. Ba? OMG. Yun na. So, eto siya, Rish. So, forward naman tayo. So, praise the Lord for that, no? Oh my gosh. God is really so amazing, no? Ganyan. With all your experiences, si Ma'am, si Miss Janine is saying that she is also APAS. Janine Kabatingan Bagayas is also APAS, and she said that she can relate po sa injections, di talaga, at saka dapat naka-alarm para di makamiss. Salute
Totoo.
to you, sabi niya. Ayun, ba? Grabe. Yun ang struggle na yun. Pero Rish, when were you informed na suspect ka na kailangan kang iswab? And then, what was the experience like? Yung ano, yung talagang
So,
nakuha mo na yung result.
so Sunday night no, nung dumating na yung OB ko, sabi niya, Shell, may lagnat ka. Although in-x-ray ako that night ha, clear ang x-ray ko. I was informed na clear
Oo,
ang x-ray. Pero since
oo,
na may lagnat nga ako, that's one indication. So, although hindi ako mag-fit sa mga criteria nila, like, I did not have any travel history, wala akong exposure sa COVID. I was work from home since March, you know that. So,
oo.
sige lang, we subjected ourselves to the protocol of the hospital. So, sinuwab ako August 31,
Mm,
12 noon.
mm.
Super sakit. As in, super sakit.
Ano?
It has to be sa mouth, sa throat, at saka
Oo.
sa nostrils. Sa
Oh, no.
nose. Ay,
Oo,
like, ano talaga. So, it was really, really painful. And then, we
oo,
had to wait for 2 more days para sa result. At first, parang
oo.
sabi ko, yung lagnat ko sa UTI ko yan. Kasi I complained UTI a week prior kasi weekly na yung check-up ko. Pero I did not feel anything. After I gave birth, parang normal lang. I did not experience any sore throat. Ang cough ko, yung tipong simpleng cough lang. Ganun
Oo,
lang.
ana lang. Oo. So you would
Walang
not really
sipon,
suspect.
wala talaga siyang manifestation. Ganun lang yung ubo, tapos wala na rin yung sakit ng katawan ko. Although yung sakit ng katawan ko because I was like holding Rami nung or sa bed because I was
Oo,
holding the baby nung nag-crowning na
oo.
siya, nag-active labor ako. And then when I
Oo.
found it out 2 days after, I was very hopeful na negative siya. As in, super hopeful. Like, I was very proud nga na I told some people na sinwab ako, ganyan-ganyan. So, hopefully makakauwi na kami by Wednesday, ganyan-ganyan, or Thursday.
Mm.
Kasi yung
Mm.
bata is may ABO incompatibility pa. But then the news
Oo.
broke out. The infectious doctor of the hospital called me up, and then I know, it was my OB who called me up, and then she said,
Oo.
Shell, positive ka.
Oo.
So, normally, parang in denial pa, like, not really in denial, pero hindi pa nag-sink in siya. Hindi pa siya nag-sink in.
Mm.
As in like, okay, sige po, Doc. Salamat po, Doc. Thank you po.
Mm.
And then I
Oo.
called my husband, and then cool lang kami. Sabi ko, Ram,
Mm.
positive ako. Sige, wala. Sabi ko, paano yan? Baka i-isolate ako. Sige lang, mag-ano tayo sa ano nila, sa advice nila.
Oo.
Then, this one, clear ang ano ko. The second person I called is my sister. Diba,
Mm.
remember, nagpaalam na ako sa kanila
Yeah.
na kung ano
Oo,
mangyari.
na
So,
gano'n
he
kung anong
wrote back ko,
mangyari.
sabi ko, this is the end. Sabi ko, baka kung ano mangyari sa
Mm.
akin, please continue, ano ganyan. Sabi niya, hindi, wala yan, okay yan. Ganyan, ganyan. And then sabi ko, sige lang, we'll see. Pero, I was crying na. As in like, doon na nag-sink in. As in, doon na nag-sink when I talked to my sister. Kasi,
Oh my
syempre,
God.
I can open up that ayoko rin ma-stress si Rami
True.
because he was taking care of the baby
True.
kasi sineperate na kami. Sineperate na kami right
Oo.
after. Although
Oo.
nakaunang yakap ako, and then naka-breastfeed konti sa baby. Pero basically, sineperate na kami for 2 days. So, the third person I called is a good friend of our family, Dr. Jean. And I was crying like, Doc, 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 positive ako, Doc. Anong gagawin ko?
Mm.
So, yun na yun. Sabi niya, don't worry, Richelle, it's curable. So, sabi ko, sige, mabubuhay pa pala ako. Kasi it's curable. Sabi niya, mataas ang rate
Mm.
ng recovery niya, huwag ka mag-alala. Then, I will call you
Mm.
back later. So, while waiting for her call back, the fourth person that I called, I remember it, was my best friend, Lai Legara. And then after that, I also called Sir Alex from USTP to let him
Oo.
know na, yun na nga. And
Mm.
Um, and then also I called Ching, our care group member. So sila lang muna yung
Mm.
nakaalam at that time
Oo.
na
No?
So doon na nag-sink in. And then several people called me up, like taga City Health Office, trying to interview me. But while waiting, can you imagine? I took a picture of it. Yung kinainan ko na box or styro siguro yun, or like
Oo.
disposable lunch box. I wrote already there the timeline para
Ano?
madali lang ang contact tracing. Saan ako galing? A week prior to 28. So, madali na lang, no, tumawag sila, I only had to read it to them. So, very consistent
Oo.
yung contact tracing nila sa akin. Different people would call kasi.
Oo. It pays, no? But let's be clear lang ha, kasi buntis ka nga, and you are all, the whole time, work from home. Yung labas mo lang is going to the clinic for schedules, and at the same, for check-ups. Ano bang schedules? For
Yes.
check-ups, and you visit pharmacy to buy. But that's it. But the big question until now talaga is kung saan mo na-contract. But, eto nga, ilabas natin. We have with us, para ma-enlighten na tayong lahat, the Pediatrician-Neonatologist mo and ng Maria Reyna Xavier University Hospital, Doc Jessa Sareno. Hi, Doc Jess.
Hello. Hi,
Good
good afternoon. Thank you for the
afternoon.
invitation. Thank you. Hello to the viewers.
Salamat
Yes,
kaayo, Doc, for your time, for
anytime.
being with us this afternoon. Yes. So, Doc, ganito kasi 'di ba, while Richelle was giving birth, hindi pa nga wala pa nga result, 'di ba? Pero the whole time you were with her, naka-PPE ka na din kasi that's part of the protocol. May i-share lang tayo
Yeah.
na video. Oo.
Yeah,
No, eto
kasi
siya.
we were informed na Richelle is having fever. So,
Okay.
parang protocol lang siya. Fever as a symptom kasi
Mm-mm.
we need to be on PPE na talagang mas guarded kasi waiting
Mm-mm.
for swab naman talaga. So, it's really just protocol. Lahat may fever and cough, fever or cough, talagang sinaswab
Mm-mm.
naman talaga. Mm.
Oo. So, yun. Pero you
So,
were still able to have this. Yes, go ahead, Doc.
So thankfully, Maria Reyna provided naman level 4 PPE. So it was not really much of a hassle. When we went to the delivery room, PPE was provided for each staff talaga, na level 4 talaga.
Ayun. Kaya nga ito nakikita natin na that's you, Doc, 'di ba? This is your video.
Yeah.
Thank you so much for sharing this with us. And so nakaunang yakap at anong tawag nito, Doc? Naka-latch.
Unang yakap.
Unang
We
yakap.
really,
Okay.
we really waited for the latch. Kasi
Okay.
prior to the delivery of Richelle, parang for me, pending swab, let's not change our practice because
Okay.
there's so we did not change. I really primed na the resident na let's continue unang yakap. Kasi parang wala pa naman ang swab. Let's just do the initial face mask and everything. But we were really high risk close contact with Richelle kasi ang definition kasi ng close contact, more than 15-minute contact time. So, breastfeeding, we wait talaga for feeding signs for 15 minutes, then there's additional 30 minutes feeding. So, parang more or less, 45 minutes talaga, almost face-to-face talaga kami ni Richelle nun. No? So, parang if there's one na talagang contact time, kami ang talagang contact time ni Richelle. Kasi minimum of 45 minutes kami waiting for the signs, tapos another more at least 30 minutes na feeding time. Matakaw si Rafi eh. So matagal din siyang nag-unlatch. Yes,
parang bumabawi kasi ma'am, nasa loob mo ako, I was all this, and then eto na nga.
Nagutom siya.
Pero is it ba, Doc? Is it kahit na COVID tayo, question lang siya, na COVID tayo, encouraged pa din or recommended pa din na mag-unang yakap yung mom tsaka yung baby?
Okay, so to be honest, yung early months, mga bandang March, April, yung talagang nag-global pandemic na siya, parang there were really confusion between different organizations on how to deal with breastfeeding, no? So, parang there were division between, example, the American Academy of Pediatrics. Parang yung level of anxiety kasi ng mga tao, mataas pa. I mean, this is really a new virus kasi. So parang hindi nila alam. At that time, we don't know at that time kung meron bang vertical transmission or not. And so parang everybody's at the height of fear, takot, lahat. So medyo divided ang mga groups like in UK, WHO, UNICEF, UNICEF, WHO, tsaka yung group of obstetricians in in England, parang pro-rooming in. Parang pro-rooming in sila. Parang non-separation sila. Pero yung mga more of the scientific academies, parang more on separate kasi wala pang evidence kung nagka-transmit, no? So, hindi pa nila alam that it does not transmit to breast milk. Sa breast milk, parang we don't know yet, we don't have studies yet. So, in the absence of evidence pa, parang at that time, parang is a contest between to separate or not. Pero in the end, WHO really ano talaga, parang definite talaga ang WHO to continue breastfeeding kasi it actually the benefits actually outweighs the risk. Parang yung solid evidence of the benefits of breastfeeding is very solid talaga, Angel, versus yung maliit na potential risk of transmission. Parang talo na, no? Talo na. So, parang in the view of public health, not to really, the benefit is really more, no, in breastfeeding. So that's why up to hindi nag-waiver talaga yung WHO. So buti na lang yung DOH natin was also followed, no choice. They really have to release guidelines also na pro breastfeeding dapat, no separation din dapat. Okay, so so bandang July, yung mga academic community, nung marami ng mga studies na very low risk pala ang vertical transmission, wala palang breast milk transmission of the virus. So nag-shift na. Lahat naman ng guidelines based on emerging evidence. So nag-shift na. Ngayon, it's really rooming in. So if you ask me what is the policy, it's really rooming in. It's really rooming in, non-separation. So kung magde-decide ang mother, so ngayon, ang standard is non-separation, rooming in. Kung mag-decide ang mother, kasi shared decision-making pa rin naman, kung mag-decide ang mother na ayaw niya itabi, yun ang i-waiver. Parang ang standard room in, kung ayaw niya, mag-waiver siya. Parang ganon. Kasi yun yung standard. That's what we do in our hospital. The protocol is room in. You don't want, then waiver ka muna that you know the risk, you know so yun lang naman. So right now, the policy, the recommendation is still breastfeeding and rooming in. So,
and rooming
yun.
in. So, yun. Even, ito Doc, clarify ko lang, ito, kahit siya na the mom, like the case of Richelle, na COVID positive siya, or confirmed case ang mom, recommended pa din siya na rooming in. Pero may mga protocols.
So based on the July, mga issues, mga guidelines, is still rooming in, but talaga, that's why I really want this conversation kasi it will help educate people na more, no, na allowed ang rooming in, pero there should be infection IPC, yung infection prevention and control measures talaga. So ang fixed recommendation room in, ang current recommendation room in, pero dapat mother should wear face mask, face shield, and then should do breast and hand hygiene prior and after breastfeeding. Tapos if the space will allow, kung kaya na in between breastfeeding, the baby may be placed at least 6 feet apart. So during breastfeeding together, tapos in between pwedeng place at 6 feet apart. No, kung if the facility will, minsan kasi ang liit ng room ng ibang facility pero kung the facility will allow, pwede namang 6 feet apart, that's breastfeeding ulit, pero wear face mask, face shield ulit yung mother. So so kung compliant yung mother. So with Richelle, I was never parang I was not afraid to room in because I know she will be very compliant, no? So parang there should be the assurance also that the mother will follow.
Ayun. Kasi off cam sa ating conversation, some hospitals worry na baka the mom minsan mag-relax and then they forget to put on that mga safety measures.
So kaya parang dapat ang ideal kasi talaga is really to talk to the mom na are you na ganito ang mangyari, we will room in, we call it co-location, ang tawag ngayon, co-location. So we will we will room in the baby with her provided that you can follow this this protocol, this infection control protocol, these safety protocols before, during, and after breastfeeding. So even ang isang recommendation nga, even you don't cough or sneeze in your sleeve kasi your baby is always there. Diba? So don't wear face mask, face shield, and then hand hygiene, plus don't cough or sneeze on your sleeve kasi you usually place your baby there in your sleeve. So ganon, kahit ganon ka minor detail. Oo.
So, di ba, Rish, matanong kita, how was your experience yung given yung mga advices ni Doc na yun nga, naka-face shield ka, and then you mentioned also off-cam na while you were doing your breastfeeding, you were not allowed to, you did not speak to your baby because you're too protective. Ana, ganon.
Yeah, just
What
like
was it like?
just like yung sinabi ni Doc, like I was really serious to comply. Like serious ako to comply. Okay, in the sense na I really, when she told me na I have to wear the mask, it's not just the mask na surgical mask. I wore KN95 mask, 5-ply, and then surgical mask which is 3-ply. Okay? And then naka-face shield ako, and then sa facility kasi magkasama na kami, I really requested for because there is no own bathroom or toilet. So common bathroom siya. So I have to go outside, pero I have my own room. So nag-request ako ng timba at saka planggana. So what I do is like I put like every now and then nag-hand wash ako. Hindi lang hand wash kasama ang arm.
Okay.
I just don't wash my hand. Api lang kasama ang arm. So yun, I really wash it from time to time. Mag-change ako ng diaper, magba-breastfeed ako sa kanya, and just like what you said, I really don't speak kapag bini-breastfeed ko ang bata. Like usually, di ba ko, on normal circumstances, we talk to the baby like, hey, ganyan-ganyan. Pero doon, naka-face shield ako, quiet. As in like, I shut my mouth. Until matapos siyang matapos siyang dumede o mag-feed sa akin. Just to avoid lang yung vertical transmission. Kasi I was still 15 days, less than 15 days that time. So, I know, potent pa yung virus at that time.
So yun. Pero was it any yun na nga. I have more questions ganito kasi I want to know. Baka yung mga viewers din natin, we have more than 100 viewers this afternoon. Thank you so much for joining us this afternoon. If you have questions about this, the experience of Richelle, and we have Doc Jessa also with us who will answer your questions. But before that, Rish, bago natin pag-usapan yung ano yung experience mo doon sa facility and your process pa more about breastfeeding and that, we'll pause for a break. We'll be right back. All right, we'll share with you this trivia about breastfeeding. Watch this.
Breastfeeding is a trait unique to mammals. Also known as lactation, its period vary from different mammals, from hooded seals that feed their young with milk for only 4 days, to orangutans that nurse their young even up to 8 years old. Here are some other fun facts about breastfeeding. The term mammalia was coined by the father of taxonomy himself, Carolus Linnaeus, in 1758 to describe the group of animals that produce milk to feed their young. The term is a Latin word which literally means "off the breast," which later on became a co-opted word for mother. If you think human pregnancy is long, think again. On average, human pregnancy takes at least 266 days, or about 9 months. Larger animals such as whales and elephants, however, is an entirely different timescale. The gestation period of whales takes 550 days, or almost a year and a half. Elephants, on the other hand, take a whopping 624 days, which is the longest for any mammal. The general rule of thumb for the number of young that a mammal's body could handle is the number of nipples the mother has divided by 2. For instance, humans have 2 nipples. Thus, dividing it by 2 would result to 1, which is the typical number of offspring humans have per birth. This is to make sure that there is enough milk to go around for lactation. A huge exception to this rule is the naked mole rat. Despite having only 10 nipples, 1 litter at times give off around 30 offspring. In general, mammalian offsprings are nursed by their own mother, but not the lions. In a pride, cubs can be nursed by literally any lioness, regardless if it was their mother or not. Animals in general have a regular cycle of waste excretion, which is mainly composed of materials that cannot be processed by the body to be utilized as a source of energy and the likes. The newborn calf of an okapi or the forest giraffe, however, is able to efficiently use the milk of their mothers, as they are able to not excrete waste for an entire month from their birthday. And that's our trivia. Till next time.
All right, we are back. And yun, no? Ganun pala nag-start. And Doc Jessa is also with us still. No? So, trivia, manal din pala. Dahil sa kanya. Tapos So, yun. Eto nga, you were brought from the hospital to a facility because thankfully, mild case ka na COVID. Yun. Pero there was a time na parang ilang days ba na you were separated pa from your baby because may condition din si baby?
Yes. Nung tinransfer ako from the hospital to the facility, I'm supposed to go with my baby. Pero ang problema, mataas pa yung bilirubin niya. Like, meron kaming ABO incompatibility. Like, baby, O plus ako. So, merong breastfeed ko siya. So, kailangan pa siya mag-undergo ng phototherapy. So, naiwan siya sa hospital and private nurse yung nag-alaga. Until such time na, according kay Doc Jessa, is like, kailangan bumaba yung bilirubin niya and that's safe enough for her to be transferred sa facility. So, it took like 2 to 3 days, Doc, no? Mga 2 to 3 days pa yun.
Yeah.
Bago ma-transfer. And then, medyo na-expirate siya ng konti kasi nag-IVIG.
Yes.
Na kami,
Kasi hindi...
Ano yung IVIG?
Had we opted for phototherapy, siguro mga 1 week. Just like my firstborn. Pero kailangan na talaga siyang aside from the fact na engorged ako kasi 'di ba breastfeed ko siya the diet before I was transferred. So imagine I'm throwing out yung what do you call this? Milk. Very precious the golden milk ng days na hindi ko siya kasama kasi nilalagnat na ako every afternoon kasi engorged siya. So, ini-express ko na lang siya and I don't have any means to store it. So, wala lang, siya, wasted lang talaga siya. Just for me to, just for me na hindi lagnat at saka hindi magkaroon ng mastitis.
So, pero what about si baby sa hospital? Breast milk pa din ang
yes.
Kanya.
We are giving express breast milk, no? So I think Richelle has a big network of friends. So so a lot of especially modern nannies, no? So a lot of good-hearted moms really donated their milk for the baby, no? So no sa akin na artificial kasi we would like to have the antibodies again and the the immune protection that breast milk will offer. So parang while away from Richelle, expressed breast milk by cup feeding, we don't give bottle. So we give
Yes.
so the nurses who were assigned to the baby fortunately underwent lactation management training, so they know how to do cup feeding. So everything was cup feeding
Galing.
there because I don't want talaga nipple confusion. Pagbalik kay Richelle, I know kasi they will be reunited. So it will be sad na pagdating kay Richelle, nipple confused si baby. So it's really cup feeding. And actually sa hospital policy, talagang cup feeding naman talaga all babies doon na separated from the moms.
Ay, galing. Because I was about to ask, bakit hindi na lang siya pwede mabigyan ng formula kasi ilang days lang naman. Yun pala. Yun pala. Diba?
So that will defeat the purpose. Kasi all the more the baby needs this COVID time, the baby needs the protection of breast milk. So it might be Richelle's or somebody else's, but at least it's still breast milk for the baby. Yeah.
Oo. So yun. Salamat. Dyan, Modern Nanays of Mindanao, yun talaga, nagvo-vote in yan sila palagi. Pag hats off kay Nadine and the team. Yun. Pero so, Rish, yung when you were already in the facility, were there any challenges na na-experience mo? What was the setup na dun sa facility? Kasi ikaw, COVID positive, tapos room in kayo, pwede mo ma-share how distant was the baby and ganon?
First, thankful ako kasi favored nila masyado yung mga postpartum. So
Yes.
so and then Doc Jessa endorsed us to the head of the CIU. So nabigyan talaga ng like a decent accommodation. So hindi ako na-join with other patients. Usually kasi kahit anong sabihin natin, like 1 or 2 people in one room. So solo yung room. Okay, solo ang room. It's really small, to be honest, like single bed. And then sometimes you cannot open the door na nga kasi nga babangga na siya sa bed. Pero the good thing with the facility that I was assigned to is like that they provided yung hospital crib. I think I have a picture there, yung hospital crib. So every time on a normal circumstance, okay, ang baby co-sleeper kami. Like, I sleep together with the baby. Pero in the case na COVID nga ako, what happened is that kailangan malayo siya sa akin. So, I think, Doc, more or less 1 meter siya.
Yeah, that's good. That's okay.
And that's the only time na, that's the only time that I get near my child is that pag nagbe-breastfeed ako at saka nag-change ng nappy. So, pag nag-change ako ng nappy, sinasabay ko na rin na punasan dito. Although, I've been trying my best talaga to para paliguan siya. Hindi na lang, pinupunasan ko na lang para lang mas mabilis at saka, less ang exposure niya sa akin. So, yan yung hospital crib na, which I did not expect, I thought, lang. So, actually, for 2 days na nag-anticipate ako na dadalhin yung bata, I cleaned, I requested for a clean, bed sheet, nag-disinfect ako ng room, and everything, ko ng sleepers inside the room and outside the room, kahit sobrang liit lang ng room na pwede na siguro isang sleepers na lang. And I did not expect that they will provide yung crib mismo. And I was thankful na dun lang sa facility na na-assign ako, dun lang ang meron ng hospital crib. Kasi sa ibang facility, after 15 days kasi na-transfer ako sa another facility together with my family na, walang hospital crib. Good thing though, kasi lagpas na ng 15 days, pwede na siyang co-sleeper. Pero sa facility na first, hospital crib talaga.
So yun. Yes, Doc. You want to say something?
Actually, I know somebody will ask this. Was the baby swab? No, so I did not order swabbing of the baby because number one, the baby is asymptomatic, and you know how how rigid is our testing kit. So selective swabbing kasi kami ngayon na yung talagang yung criteria. So the babies actually with the background knowledge na there is really low transmission rate ng intrauterine transmission. Plus there's no risk of breast milk transmission. And the baby is asymptomatic. Parang I don't want the baby to undergo that painful procedure of swabbing. Of swabbing. So that's why I really ask Richelle, if you will be compliant, same room kayo, pero yun, 1 meter apart, tapos all the respiratory precautions and cough etiquette, para paglumpas na, pwede naman kasi if the baby will, the protocol, the recommendation says, the PSNBM recommendation says, if the infant is not swabbed, at least for 14 days, yun ang gagawin. No? So after 14 days, pwede na silang banding-banding, skin to skin. So after 14 days, sabi na si baby. Because ano na kasi tayo ngayon, Ma'am Angel, it's more of time-based and symptom-based tayo. Hindi na po tayo yung test-based kasi it will prolong hospital admission. So ang RT-PCR kasi can be positive in a COVID patient can be RT-PCR positive for weeks, ilang weeks. So if sa case ni Richelle nga, naka 3 times pa siya na swab na positive. But it doesn't mean na contagious na pa rin siya. No? So a positive RT-PCR does not always mean infectivity. No? So it doesn't always mean na parang if you are does not always mean infectivity or very active pa ang viral replication. So minsan lang it just means na nandun pa siya pero yung kaya para more of time based tayo, 14 days, yung 14 days na infectivity. After that, kahit positive ka pa sa RT-PCR mo, parang hindi ka na dapat kasi contagious. Yeah. So yon. Kaya after 14 days, I told Richelle, then you may co-sleep na after 14 days ni baby. Kasi baby is really symptom-free. No? So, except for the jaundice because of the blood incompatibility. Otherwise, wala naman. So, just to tell everybody, ang current updated guideline ngayon, when is really more of a time-based and symptom-based recommendation in terms of infectivity. So when you say time-based, after 10, actually, ang nakasulat, after 10 days na nawala yung symptoms mo talaga, and then after 24 hours na febrile, tapos yung wala talagang symptoms. No? If I'm not mistaken, yun yung 3 criteria. No? Then kung medyo critical ang COVID mo, 20 days. So kung asymptomatic ka or mild, 10 days. Then kung critical, 20 days. So yun, hindi na masyado yung RT-PCR na negative.
Okay.
Hindi na masyado.
You
Angel.
Doc. Yes, Rish. You have a question
If I may
Doc?
add like yung sinabi ni
Sige,
Doc
go
na
ahead.
may symptoms, sige, before someone asks, nagkaroon ba ako ng mga symptoms during the 15 days? If I remember it right, kasi I have the timeline and then I remember the text messages that I've been sending out to my friends. On the 7th day, 8th day, 9th day, I developed cough, persistent cough. Remember, I don't talk to my baby, pero grabe, there's a persistent cough na kailangan ko talagang umubo. So, in that case na kaya ko pa siyang pigilan, pinipigilan ko, pero pag hindi ko na siya kayang pigilan, I would really put the baby to the crib. I will cough out to the, to the end, like super cough out sa bathroom. Doon ako nagka-cough out, like totally labas lahat ng cough. And when I feel it's okay, that's the time I go back to the room and then continue breastfeeding kung ano pa siya. Kung okay pa siya. Pero pagdating ng I think 10th day, medyo nag-diminish na siya. 11th day, parang I remember Sir Alex told me, kaya medyo nabubuhayan talaga ako ng loob noon during that time. He was updating me kasi sa research base. Sabi niya, Shell, ang 10th day, ganito, ganyan. By 11th day, medyo okay ka na yan. So, yun ang nasa isip ko. By 11th day, okay na dapat ako. But the 10th day, that was like make or break. But then, since
Oo.
I became better on the 10th day, pero naswab ako on the 10th day. So, medyo hopeful ako sana negative na siya. 11th day, medyo nag-okay ako. 12, 13, medyo getting better na ako. Pero I think ang pinakagrabe lang talaga was the cough on the 7th, 8th, and 9th day. Na to the point I was like catching my breath. Like, my room, the room in the facility kasi sa second floor. So
Oo.
imagine, I have to, every day, I have to go down to get food. I also have to go down para magpainit kami ng bata every
Oo.
morning.
Morning
Every morning si
sunrise.
Doc Jessa magte-text sa akin, Shell, kamusta? And then at that time, nasa labas kami noon. So I always bring my cell phone with me para
Mm.
para pakita na yon nagpainit kami ng araw. Yan. So
Mm.
I have to go down. Going down is okay nung nagkaroon ako ng cough. But then going
Mm.
up. So yung mga
Yun
tinext
na.
ko during that time na nagsi-struggle ako sa ubo at saka medyo meron talagang shortness of breathing. Yun yung grabe, yung pag-akyat. Remember, 2 face mask meron ako plus the face shield. So my cousin who was a nurse, who's a nurse sa Iligan, told me how to
Mm.
manage my breathing. So when I
Mm.
go up, like I always pray yung last 3 steps. Sabi ko, Lord, last 3 steps na lang, kailangan makaya ko siya. And then, I will really breathe in, yung pinaka-grabe na breathe in. I will remove it, then to the side.
Mm.
Breathe in, balik, breathe out, nasa loob mismo ng mask.
Mask.
Then, I
Oo.
enter the room, lapag ang bata unang-una, then, labas ng kwarto, tanggal ang mask sa CR. I breathe in, breathe out, breathe in, breathe out. Tapos, ubo ng ubo ng
Mm.
ubo.
Ah.
Yan, then babalik ako ng kwarto, hugas kamay kasi lumabas ako, ako sa CR, ganyan, umawak ako ng doorknob, something like that.
Oo.
So, hugas ng kamay. Kahit minsan umiiyak na yung baby na kailangan na niya mag-feed, sabi ko, sige lang, wait lang, give me 1 minute. Yan, para lang
Mm.
makumpleto yung washing, makumpleto yung maka-change na ako ng mask at saka ng face shield.
Oo. Wow. Grabe. I couldn't imagine.
Compliant.
Oo, compliant
Very
ka
good.
sobra. Two-face mask pa. Very, very good. Pero may question dito si Miss Jane. Nasagot mo na yung first question niya kung when tinatanggal mo ba daw yung mask pag nag-cough ka sa bathroom. So yeah, tinatanggal as you mentioned. Pero eto tanong niya, how do you disinfect din yung room ng CR na andyan si baby? Toxic yung chemicals. So ano daw gamit mo sa pag-disinfect? Rich.
Bleach ang gamit ko sa pag-disinfect sa room. Ang ang CR, it's a common CR, so doon grabe ang
Hindi.
disinfection. Pero sa room, I dilute it in water. And then I
Okay.
only I disinfect first yung wall na sinasandalan ko. Yung
Okay.
wall na malapit sa crib, pero very konti lang ang bleach. So hindi siya masyadong
Okay.
matapang. And then more on alcohol. Alcohol na lang ako. And then I wipe it with tissue. So yung mga nagpadala ng tissue sa akin, super thank you talaga, as in. Yun yung ginamit ko pang pang puna sa wall, and then sa may sa floor, it's bleach.
Oo.
Hindi siya masyadong
Ah.
matapang. At least I disinfect it like every day. Kasi everyday ako lumalabas, pupunta sa CR, pupunta sa baba, makakahalubili ibang patients. So, yun
Oo.
lang. Don't worry, it's not so toxic naman.
Oo. Kasi nga compliant si Richelle. Kaya nga din, yung face shield mo, you pinapalitan mo siya every 3 days? Yung face
Yes,
shield?
nagpabili ako kasi people can send love gifts. So talaga ako, nagpa-request ako nag-ask ako sa friend ko na bumili ng mga face shields. So after 3
Okay.
days, sometimes yung 4 days na, so dinisinfect ko lang siya ng alcohol tapos pinunasan kasi hindi pa dumadating yung new face shield. So ayun, every 3 days or pinakamatagal na yung 4 days, change na ng face shield.
Ayun. 'Di ba? Better safe than sorry. Kahit na, yun nga, ang rule na naman ng husband ko, bahala ng praning sa pag-secure ng kaysa naman, you can never can tell. Sabi nga, you can never can tell. Yan na, you can never tell. May comment si Ma'am Ange, God is really amazing because He allowed breastfeeding pa rin despite COVID. May all breastfeeding mothers and babies be safe always. Salamat, Ma'am Angie Pizarro Monsanto, for always supporting our advocacy. Yun, Doc, may question ako about kasi si Richelle may medication, Rich, no? You were given medication din sa COVID mo?
Yeah.
Oo.
Yes,
Wouldn't
yes.
that, wouldn't that, bago na, para ma-establish lang natin, Rich, anong medications ang binibigay sa'yo? As,
When I went,
sa fighting sa
when,
COVID?
when I was still in the hospital kasi, like, di ba sabi ko ang ubo ko, ano lang ganito, like, hindi siya invasive, or hindi siya
Oo.
persistent. So, before I was discharged sa hospital, niresetahan na ako ng, okay lang sabihin, Doc, Jessa ang brand, ay ang name?
Okay lang.
Yeah.
Ang name
I was
ng
given
medicine na.
Tergicef. I
Yeah.
was given Tergicef.
Okay.
Twice a day ko siya i-take. Twice a day ba? Yeah, twice a day, morning and then evening. And Tergicef, familiar ako sa Tergicef, not because I have taken it, but because that's the medicine ni Ramiel, ng firstborn ko. Di ba, Doc?
Okay.
Tergicef. At saka,
Oo.
medication din siya ni Rami. I never had pneumonia. Never had pneumonia. So,
Until COVID happened.
ba? Ano siya?
Oh.
I don't know if I had pneumonia during the COVID, ha. Pero kasi hindi na ako na X-ray eh. But then I was given siguro pang advance na lang siya just in case na mag-progress.
No, I think Rich, because you have UTI also.
Okay.
Yeah, so I think it's more for your UTI.
Okay.
So marang hitting two birds na. So UTI, the medicine kasi can hit both UTI and respiratory tract infection. So I think
okay.
and you're having fever din eh. So I think it was warranted because on your urinalysis meron din ka talagang medyo mataas ang WBC mo, and then you have cough. So parang that medicine can hit two birds with one stone. So yeah, that's okay. And it's safe. So for Ma'am Angel, that's safe for breastfeeding. That's safe for breastfeeding.
I was about to ask.
Yeah, that's safe for breastfeeding. Yeah, so I know naman, I know kasi the obstetrician of Richelle is actually breastfeeding friendly also. So she actually prescribed medicines who is actually breastfeeding safe. No, so that's the one thing we agree on it. Na we agree on it. So
yun.
Even antihypertensive talagang we discuss which is safe in breastfeeding.
Ayun. Kaya pala. So, okay lang siya. May isa pang question si Ma'am Jane Wisdom Javier Galiana. Para sa'yo ata to, Rish. Yung mask mo po, how often you change?
Every 7 to 8 hours. Pero sometimes lessen siya kasi nga, pag umuubo ako or like, basta feeling ko, marami na siyang liquid because of the saliva. I change it even before 8 hours. So, sometimes, 5 hours or 6, pinakamataas na yon. Nagpabili ako ng 2 boxes ng surgical mask, so that's 100 pieces. Hindi ako nagtipid, promise. Tapos, KN95, 50 pieces.
Okay.
So, like morning and afternoon nag-change ako para pagkagabi na matutulog na 2 plies na lang ng surgical mask. Pero pagka nandiyan na yung baby, magbe-breastfeed ako all throughout the night, chini-change ko siya into KN95 kasi syempre matutulog ka. Kung naka KN95 ka plus naka surgical mask, tingnan to, parang nasasayang ako sa KN95 kasi it's more expensive than the surgical mask. And another thing is that ang others might think baka pwedeng hindi na lang nakamask kasi matutulog ka na rin lang naman, hindi ka naman magsasalita. Pero I still breathe. And during the time na nag-progress yung cough ko, na-feel ko na parang I speak in my sleep. Yung parang, I don't know kung basta na-feel ko siya na parang I cough in my sleep or something. So, nag-mask talaga ako even in my sleep.
Wow. Grabe. Yes, Doc Jess, you have something
so,
to say?
I really need to say this before tayo mag-end. Baka I will not be able to send
Yes,
directly my message to everyone kasi I really want to get this opportunity about
Yes, po.
breastfeeding. So, for the information of everybody, breastfeeding is really recommended. As of this point, from parang because of the emerging evidence talaga, that there is really increasing evidence that there's really no breast milk transmission. Breast milk is not a transmission vehicle. No, it's not a transmission vehicle for COVID. In fact, it is being tested, diba? If you heard the news, being tested for possible protective na
Yes.
sure, no? So there's a big study in Beijing that showed that it actually suppresses the virus. It suppresses the virus. It actually blocks viral attachment, entry, and post-entry replication. No, so you know what? If you really study about this, it's actually the antibodies in the breast milk and the lactoferrin. The lactoferrin in the breast milk is really the one component na mayroong major role in the breast milk that can block viral attachment. Nag-a-attach kasi to, I don't know, baka masyadong nosebleed, pero itong lactoferrin kasi is a protective factor siya sa breast milk na parang it prevents viruses to anchor into the surface of the cell, of any body cell. So, pag blinak ng lactoferrin yung anchoring ng virus into that cell, no? So, it will prevent the COVID virus to recognize the more virus-specific receptor. So, meron kasing mas COVID-specific na receptor. Ang tawag doon is the angiotensin converting enzyme to ACE2 receptor. So, once ma-attach si COVID sa ACE2 receptor, wala na, baka tuloy-tuloy mag-entry yon sa cell. So, yung first phase, bago siya mag-attach, binablock na ni lactoferrin in the breast milk. No? So, parang it prevents the virus to, yung lalapag pa lang sa cell, to recognize the ACE2 receptor. So, kung makita niya kasi, parang tao, pag nakita na niya, mag-attach na siya. So, wala na. So, parang si lactoferrin, prevent niya or yung breast milk, kung ano yung component na parang nag-prevent ng viral entry, parang piniprevent na niya si COVID to go into the site na makikita niya si ACE2. Parang parang love story. No? Pero parang gano'n. No? Ayaw mo i-attach si COVID kay ACE2 receptor kasi yun yung point of entry na pwede siyang
ang galing.
So that's the beauty of breast milk. Breast milk, aside po from the IgG, IgA, the colostrum, the antibodies found in the breast milk. So very consistent po yung study na yung pinag-aralan ng mga breast milk, ang taas po ng secretory immunoglobulin na nakikita. No? So meaning to say, when a COVID-positive mom breastfeeds, parang nagbibigay siya ng partial immunity to the baby.
Ang galing.
May nakikita talaga na mga antibodies na specific IgG, IgA. So this is very important, Angel, kasi nasa third world country po tayo. So kung iwiwin mo po, in a third world country, ang mataas talaga na cause of death, the mortality and morbidity, ang pinaka-top kasi is pneumonia and diarrhea, no, in children. So, ano yung pwede makaprevent ng pneumonia and diarrhea is still breastfeeding. So, in a public health point of view, parang wala na, talo na yung maliit na potential risk of COVID infection compared to the very solid evidence that breast milk can protect pneumonia and diarrhea during infancy. No, so because of the protective immunoprotection of breastfeeding. So that's why if you will see UNICEF, WHO, DOH is really promoting breastfeeding with this idea in our mind na parang mas maraming bad na mangyayari kung hindi mag-breastfeed. Mas maraming bad, parang mas maraming disadvantage kung hindi mag-breastfeed. So why not breastfeed and just do the respiratory precautions? No? So,
Yun.
the risk kasi, they found out kasi sa ibang studies na parang yung risk pala of COVID, if you separate the mother and the baby, and the risk of, they studied kasi 1,500 mother-baby pairs, Angel, no?
Oo.
And then
Oo.
they found out that yung likelihood pala to get COVID between separated and non-separated is actually the same. So separation does not offer actually significant protection. So might as well do not separate. Aside from with you not separate, no significant protection naman ang non-separation, you get pa the benefits of breastfeeding if you don't separate.
Yes.
So parang win-win.
Oo.
Win-win tayo.
Oo. So, di ba, at aside from the facts nga na free yung breastfeeding, so more than anything else, it's a pandemic, you have to resort to breastfeeding. May question, Doc. Medyo na-mention mo na siya, pero sabi niya na late lang daw siya. Hold on. I'll just remove the banner para mas clear siya. So, yun. Ang question niya is, ni Ellen Claire Cano Sullivan. Hi po, just logged in po. I've been directly exposed to a COVID positive. I'm still waiting for swabbing. Can I co-sleep with my 2-year-old baby and breastfeed po? 2-year-old ang baby niya, Doc.
So again, the protective, the benefits of breastfeeding. So if you really want, if it causes a lot of stress, if the baby will separate from you, I mean, some babies makakatulog lang kung nakalatch sa breast, no? So aside from the stress na baka COVID ako, then here you are stress na separate si baby. Paano siya ng iyak sa kabilang room kasi sineparate ka? So why not do the hand washing, the face mask, face shield, and then breastfeed the baby. Don't cough, don't talk, don't sneeze. Breastfeed the baby, let the baby sleep. Then once nakatulog na, then separate ulit. No?
Yeah.
Don't add stress to your, stress ka na nga kung ano ka ba, positive swab ka ba. No? So I think I will still go for non-separation, but do talaga be very compliant. Kung hindi ka makakomply, talkative ka masyado, sneezing ka, coughing ka, without doing face mask, then baka you need to separate. Pero to have that additional stress that your baby is so crying in the next room because she's separate from you, might as well itabi mo na and do all you can do na respiratory precautions. Anyway, sa breast milk, hindi naman magta-transmit sa breast milk eh. So, Ayan, I'm sure of that, no? Kasi talagang not a transmission vehicle yung breast milk. Okay, so yun lang. Grabe ang psychological impact of separation, especially on a mother na bagong nanganak. No, the psychological impact of COVID on postpartum moms. No, so super big. I mean, aside from the usual postpartum blues, no, kahit walang COVID, nagpo-postpartum blues sila. Dagdagan mo pa ng psychological impact of being being COVID infected. So, walk with me the scenario walk through with me.
Sige, Doc.
So, for example, nag-separate ka. So now your baby is separated in somewhere, you don't know where, in a NICU. You will have the risk of number one, more times na in contact with health professionals, doctors, clerks, interns, nurses coming in or whatever. No, different shift of nurses. So there's increased contact with healthcare workers that you don't know, maybe asymptomatic positives. Diba? Now, we are not being tested regularly by the hospital. That's one. Number two, there's a possibility that your baby will be in a crowded ICU, crowded NICU. No? So again, even without COVID, a crowded NICU has increased risk of infection. Okay? Tapos number three, because of an increased risk, crowded NICU, especially in a government hospital, kunwari, no? There is also a non-ideal nurse-patient ratio. Kung sobrang dami nang naka-admit in the NICU, kasi ang daming gustong i-separate, no? Kasi takot, then there might be a non-ideal nurse-patient ratio. So, ayan na naman, risk of infection na naman. There might be a break in infection kasi hindi na kayang sobrang OC ang nurse kasi ang dami niyang binabantayan. And then, plus the high risk of infection or morbidity in a healthcare setting. Plus the psychological stress of the mom. Anong nangyayari doon? So parang Kaya I'm not really a fan of separating kung hindi kailangan. No? So, yun. And the fact that the studies show it does not offer pala talaga significant protection. So, if you will read journals, ang dami ding nag-i-infect ha, kahit separated. Ang daming postnatal newborn infection na separated from the mom. So parang you cannot lobby na zero infection kasi sineperate sila. No? So for me, very strong talaga yung study na yung 1,500 babies. Yun actually ang nagpabago ng isip ng AAP, American Academy of Pediatrics, kaya sila nagpa-room in na, nag-change sila ng guidelines. Kasi national registry na yun eh. No? So yun lang ang ano ko na parang the psychological impact of separating the babies is additional also to the risk of infection when separated from you din yung baby in a neonatal ICU din na pwede talagang hindi ma-observe, pwede talagang exposed to an asymptomatic healthcare worker. I was telling the nurses, huwag kayong matakot, like there's a baby na COVID suspect pa ang mom. Actually, huwag kayong matakot sa baby. The baby does not cough out upward na trajectory to infect you. It's actually kayo ang, di ba, when you're carrying the baby, kayo ang nakaduko, yuko, na pwede talagang ma-infect yung baby. Ang baby dapat ang matakot sa inyo. So, yung parang yun yung, yun yung aking sa nurses. Kasi, pero I will understand kasi yung heightened anxiety nga. No? So, actually, yung kay Richelle, heightened anxiety ng konti talaga yung hospital kasi it's the first time na pregnant positive. I think Richelle made history in the hospital. So, ayan, okay. So yan lang kasi yun yung point ko na I think it for ma'am sino yung nagtanong for ma'am might as well just do the respiratory precaution and really practice infection control, breastfeed, hand hygiene, and everything, rather than bearing the agony of your baby crying. No? So parang added stress mo tuloy pa.
Oh, I learned a lot.
Okay.
Nakamute siguro.
Nakamute ka, ma'am.
Can you hear me na?
Okay, yeah.
Yes, yes.
Ayun. May i-share ko lang sa inyo. Ito, asan na yun sa may comment? Ayun. From Mayan Silvestre. Watching from Quezon City. Congratulations, Mami Richelle and Doc Jessa. Galing-galing. Galing-galing. YouTube
Mami Yan is my mentor. So all I learned is my breastfeeding mentor.
Yay! Yay!
Hi,
Mami
Yan. Hi, Mami Yan.
Big part siya in my breastfeeding journey.
Yes, and sa mga advocacy ni ni Doc Jessa. And then there's also here, sabi ni Ma'am Riza Joy Biroa. Very informative. Thank you, Doc. And
you're welcome.
Yun, paano tayo? Pa-good vibes tayo. Hello, Doc Sareno, si Maria Enra Borromeo Leocadio. Hello, ma'am. Hello, Doc Sareno. You were my daughter's pedia when I gave birth last August 28. I was discharged before Richelle came to the hospital. It's nice to see you and Richelle here. Stay safe always.
Yan, nag-communicate kami niyan. Napasok ako. Apas din yan, apas.
I know.
Oh my gosh.
Apas sister.
Apas sister. And si Ma'am Lera Faye de la Rama, Kotiangco de la Rama, as always, very informative, Dr. Sareno. Well explained po. Thank you. Regards and stay safe. From baby Ellen de la Rama.
Yes,
congratulations.
I just saw her in the clinic.
Yon pala siya. So, I believe wala naman siguro mga comments sa ating mga questions sa ating mga And Ma'am Isay pala, hold on. May comment si Ma'am Isay. Asan na siya? Ma'am Isay, ayun. May comment si Ma'am Isay sa inyo. Salute for mothers who are always looking for what is best for their children, including going for breastfeeding as a choice. Yon. And si Sir Ahmad, basa na lang sa mga comments. Salam at makulimlim na hapon po sa ating lahat. Taga-subaybay ng ito na napapanahon po para sa mga nanay na taos-pusong nagpapadama at nagpakita ng pagmamahal sa kanilang anak sa pamagitan ng breastfeeding, lalo na ngayong pandemic. Mabuhay po kayo. Yon. So, wow, grabe. Very, very enriching. I hope na yung mga viewers natin, may natutunan talaga sila, no? Meron naman. Very, very informative. So, siguro before we close this episode, I'll ask you mga messages sa ating viewers. We'll start siguro with Richelle, and then you be the next Doc Jessa. Rish,
Yes,
would you have, ayan, busy na talaga siya. Go, Rafi! Go, Raf!
parting
Ayun.
words.
Yeah, message mo sa mga moms na, just like you or who may be groping in the dark kasi may mga fears and worries about,
Actually, when I posted my story sa apas namin at saka in my public wall, may mga nag-message sa akin 10, like they have concerns, they also have like questions and this and that. Isa lang yung sagot ko. I always remember kasi sa Holocaust, like, and then yung mga tipong nasa, like, deprived of a comfortable life. They didn't have any choice. Wala pa kasing formula milk in the past. They only have, it's not even a choice. They only have one means of feeding their children. And that is through breast milk. Okay, so sabi ko, kahit siguro stressed ka, kahit siguro may sakit ka, kahit yan, may virus ka, may COVID ka, mas effective pa rin yung breast milk na ipakain mo or ibigay mo sa anak mo kaysa sa mag-opt ka sa formula milk or some other means na hindi ka sure or masa-separate siya sa'yo. So, yun lang yung pinaka-stronghold ko. Like, ever since sa experience ko kay Ramiel na she was only 1.85 kilograms and then she grew this healthy. So, sabi ko, kung nangyari yun sa anak ko, sa firstborn ko na naging healthy siya, na breast milk lang talaga yung pinakapuhunan ko with a lot of faith. Okay? That's the same that I did with Rafael. And I think mothers out there, tiwala lang tayo sa binigay ng Diyos. It's the natural food. So kung hinayaan ka niya magbuntis ng 9 months, magpo-provide din siya ng pagkain sa anak mo. And that is through the milk na nasa katawan mo mismo.
Amen.
So yun lang, sana ma-inspire sila. Breastfeeding, I can only personal belief ko yon, and then also kay Doc Jessa, very scientific. I think mas mako-convince kayo na mag-breast milk talaga because it's backed up by studies, and fan tayo ng we are a believer of natural and then also scientific studies.
No? Thank you so much, Rish, for sharing your story with us. You are truly an inspiration. At medyo harsh nga ako kay Richelle na I was checking on her while at the facility. Rish, kasi she's telling me all these mga nakaka-chills na na mga stories niya about how amazing God is and how everything went well sa kanya. Eh sabi ko, Rish, please share your story with us when everything is okay. At kaya nga nangyari ito. So yun. Doc Jess, would you have your message also para sa ating mga mommies, expectant mommies at mga mommies? Kasi we have also mga nakikinig na who joined us na expectant mommies.
Okay. So thank you so much for this afternoon. I will give a take-home points, the medical side of it, and then I'm gonna have a take-home point for the mothers as well as yung mga breastfeeding advocates, yung mga groups, mga breastfeeding groups who are listening here, my colleagues in the breastfeeding na campaign, or the breastfeeding promotion ko na colleagues. So first and foremost, take-home points lang for COVID as on a perspective of a neonatologist muna. Neonatal COVID-19 is actually uncommon. And COVID, if ever, COVID infections in neonates are you mostly asymptomatic. So I told you yesterday, Ma'am Angel, COVID is quite kind to to the kids.
Yeah.
No? So COVID infection is are mostly, if not, if rare, is rare, and if kung mag-COVID man, it's really asymptomatic. In fact, as of August 24, we have 179 na babies na COVID positive for some reason, hindi naman intrauterine, parang po pwede postnatal. In fact, we only have one mortality, no? So,
Oh.
parang hindi siya ganun ka, mild disease lang siya. And the mortality may not be even due to the COVID itself. Baka dahil may infection din. So it's really not so severe in newborns. And then health outcomes in neonates are actually favorable. Vertical transmission is not yet solidly established. So sa mga mommies na sobrang mahilig mag-internet, may mababasa ka mga isang journal na may nag-positive na baby, no? But marami pong tinitignan na factors yon. Is it really intrauterine or baka perinatal? Mga one day later, na-expose na pala siya ng ilang nurses or whatever. No, so, pwede kasing ganon. So, hindi pa solid yung evidence na parang ang laki-laki ng population na talagang nagtutulog na siya. And you need to really document it with cultures of the amniotic fluid, mga ganon, mga vaginal secretions, mga ganyan. No? So, it's not yet fully established. And then, separation of the infants does not offer significant protection. And breast milk is not a transmission vehicle of infection. So, yun yung summary ng aking mga inputs kanina. So, yun, we all have to remember that the risk of COVID infection is low, while the consequences of not breastfeeding and separation between mother and child can be significant. And it can last throughout infancy, increased risk of pneumonia, increased risk of diarrhea, no? Low IQ, no? Kasi di ba, breastfeeding can increase IQ, no? IQ points. So yun, ang daming mga significant na health outcomes na pwedeng mangyari if you're not breastfeeding. Okay? And early essential newborn care or unang yakap should still continue. Remember, mas positive health outcomes are more certain than the uncertain chance of transmission, no? So, if you breastfeed, mas certain talaga ang positive outcome kaysa that little uncertain chance of transmission. So, we as doctors can only provide guidance based on the available data. So, walang fixed recommendation. Fluid pa ngayon kasi novel virus tayo. So, walang fixed recommendations as of now as new evidence are emerging based on newer studies. Kaya encourage talaga ang research ngayon sa COVID. No? So for mothers out there, if you're pregnant, please do, the best time to talk about this is actually prenatal with your OB. Hindi po yung i-admit ka na, 5 cm ka na, 6 cm ka na. No? So the best time talaga is prenatal counseling about the risk, have a birth plan. It's always a birth plan. No? So, what's the risk? If I will separate, anong risk? If I will not, ano pong risk? What can I do? Ano naman ang benefits? No? So, talk with your OB, talk with your pedia. Know the protocol of each hospital. So, kung saan ka manganganak, know the protocol kasi every hospital po, iba-iba ang COVID task force. So, iba-iba din ang level of anxiety ng mga members of the COVID task force. So, iba-iba din yung protocol. No? So, yon. And then, if possible, get an RT-PCR swab ahead of time para walang gulatan. No? Walang gulatan. So, parang marami ng OBs who are requesting an RT-PCR kung malapit na ang due date. Kung malapit na ang due date. And then, be very specific in your request. Kung gusto mo ng unang yakap, say it para makaplano na yung pedia, makaplano na yung team. Kung gusto mo talaga ng unang yakap, breastfeeding, gano'n. Okay? So the protocol, ang standard is rooming in and breastfeed. So if you will deviate from it, some hospital will do a waiver. Lalo na yung mga breastfeeding friendly hospital. We follow the standard, which is breastfeeding and rooming in based on WHO, backed up by WHO guidance. So kung mag-deviate ka sa standard, we do a waiver. No? Yun. So in conclusion, ang dami kong conclusion. In conclusion, as a doctor kasi, kailangan kasi natin na very uncertain kasi ngayon. So, if we ang mas maganda is yung may ability tayo to sit comfortably sa uncertainty na to and mold it into something therapeutic for the patient. So, uncertain tayo, pero ito naman yung patient nagpo-postpartum depression kasi separated sa infant. So, let's do something which is more therapeutic for both of us, for both sides, no? So, yun. So, acknowledging this, tas parang informed decision yung parents, so mas therapeutic yan for each other, no? So, for both sides. So, yun. So, I'm gonna end talaga. Last sentence ko from my mentor, Dr. Silvestre, no? This is message to, so nag-Bisaya na tuloy. Message to sa lahat ng breastfeeding groups who are listening right now. I'm gonna quote Dr. Ramian, keeping babies away from their mothers for 14 days of isolation period is a death sentence of breastfeeding. So kaya let's continue po promoting, let's continue informing moms that the benefits, that is okay, that we can do preventive health protocols, respiratory precautions, and can still breastfeed despite the pandemic. Yun lang po.
Yun. Thank you so
Angel
much.
pahabol.
Yes, sure.
Angel
Go
pahabol.
ahead. Yes.
Isa sa mga hindi pa aware ang mothers, ha, like they have to talk to a pedia na before they give birth.
Yeah.
What they know is like OB ang lahat. Like, ipapanganak. Pero sabi ko, may mga nag-message sa akin, sabi ko, ang pedia na ang sasalo sa bata pag nalabas na yan ng OB. So sabi ko, dapat before ka manganak, may pedia ka na. So, my advice to mothers out there, choose a pedia na breastfeeding advocate. And I'm very blessed to have Doc Jessa. Super. My firstborn and this one, especially this one.
Wow,
Kasi
naiiyak ako.
kung hindi si Doc Jessa yon, promise, I don't know. Baka meron na rin akong death sentence sa breastfeeding kung nagkataon. Kasi may protocol na hindi pwedeng i-break. So, I'm just glad that I have a support. I had a support back then. So, get a good support before pa kayo manganak. So, pag nanganak kayo, solid na ang support.
Oo. That's part of the birth plan, di ba? Kasi nga mag-usap si OB tsaka si Pedia. O, di ba? Kahit hindi pa ako nanganak. Pero medyo, kasi this is the third time nag-converse na kami si Doc Jessa. Doc, asama mo ako sa listahan dyan, ha? If ever, mangyayari man siya.
Let's do your birth plan.
Yes, oo. Pero Rish, siguro this would be an opportunity if you wish to thank people to help you sa in your ordeal. The floor is yours.
Yes, I would like to thank number one family ko kasi sila yung super kasama ko nung sa prayers and everything struggle, like yung may mga bagay na hindi ko nasabi sa mga friends ko, pero sa sister ko all out ang iyak, all out lahat ng emotion. And then thankful din ako sa USTP. Grabe yung in-extend nilang help, and also financially especially, and also ang SPUC, SPUC, South Philippine Union Conference, for providing supplies, and then for the hospital aid, grabe yung tinulong nila. To be honest, although ito ang pinakamahirap na pregnancy, pero ito yung pinaka-blessed na moment. Like, we did not expect to receive overwhelming support. So, in my time na super depressed ako, like to the point na I will not mention it anymore, like super down talaga, like hopeless na. There were people na talagang tumulong to keep my sanity. Special mention ko na lang si Laile Gara, like, sis, grabe talaga yung tulong mo sa akin. Si Ching, although nasa Indonesia siya, grabe yung yung follow-up niya sa akin. And also, ayun, si Angel, sa iyo Angel, na grabe, almost every day, text, tawag, kung pwede lang tawag, pero, text is already a good, support na. Anyway, lahat ng taga-USTP, lahat ng taga-SPUC, care group namin sa Gopher, thank you for assisting us in any way you can. Family members, relatives na tumulong na maging runner mga friends namin na wala kami, promise, dito sa Cagayan de Oro, wala akong relatives here. Si Rami lang ang pinaka-relative ko dito at saka family niya. And then his family was very assistive of us na sila yung runner. Mga friends ko, kailangan ko ng mask, kailangan ko ng timba, kailangan ko ng sabon, kailangan ko ng ganito ganyan, kailangan ko ng vitamins. They would run and then send it right away. And then thankful din ako on the last few days na super na nag-postpartum talaga ako, I breakdown kay Miss Richelle, head ng CIU, through
She's
Jello
a
Walag.
modern nanay, ha?
Oh, yeah. Gabi na, she encouraged me na, Shell, look at the blessing. Although I know that, pero sometimes when you know that, pero you need someone to tell that to you. And then sabi niya, you look at the brighter side because 3 times na kami nag-positive pa rin. And I was fighting for it na i-discharge na kami. Pero hindi pa rin eh. Mahirap kasi. So anyway, thankful ako sa binigay niyang accommodation sa amin and favor na hindi binibigay sa lahat, to be honest. Medyo na-spoil kami noon. And then thankful ako sa mga nagbigay ng food. Dr. C, sa SciEd, sa department namin na nag-provide sila ng vegetables or healthy foods. I think that's the reason why nag-negative na kami on the next swab. Kasi every single day, meron na kaming veggies na healthy food. And happy na rin ako, positive na yung outlook in life na, sige na, eto na. And then we surrender everything to God. So, ayun. Thankful kami. Like, I cannot really mention all the people here, but you know who you are. Those are the institutions that help us get through this ordeal. And today, as I look back, Angel and Doc Sareno, etong pinakamahirap pero etong pinaka-blessed. Up until now, we are still reaping the blessing. Ang supplies ni Rafael, grabe. We only bought 1 week na clothes niya. Pero to be honest, during the COVID namin, we went home with extra boxes and extra bags of clothes and supplies dito sa bahay.
Wow.
So, thankful kami sa mga tao. Some other people, hindi namin alam kung sino nagpadala ng money when we posted when USTP called for donation. So, pagpalain kayo ng Panginoon. You will always be in our prayer and I will make sure that my children will know your generosity. And then of course, thankful ako sa husband ko na grabe. Ako negative na yung mindset ko, very structured ako. Si Rami, very siya nagbabalance ng lahat ng bagay. Although chill lang siya, pero deep inside, kabado rin siya, pero he does not show it to me. So, siya yung nagsabi na okay lang yan, kung magstay tayo ng 2 months dito, okay lang. Sige lang, basta magkakasama tayo. So, choose the right partner in life para
ayun.
kung umabot sa time na super down, at least maa-uplift ka.
Yun talaga ang test, no? Yun, wow. Thank you so much talaga sa inyong dalawa, Doc Jessa and Richelle. This is so overwhelming sa lahat ng mga viewers natin. Umabot tayo more than 100 live viewers, no? Sa na nakisali sa atin. Nakisama sa atin this afternoon. So thank you so much and congratulations. May sinabi dito si Miss, hold on. I have to get my glasses. Janine Kabatingan Bagayas, amazing. Yes, choose the right person. Right, the right partner. And praise God, according to Ma'am Myla Beatriz Dejo Gregorio, praise God, we are wonderfully made. So yun, thank you so much, Richelle. God bless. And Doc Jessa, thank you so much. Mag-usap tayo after nito, ha?
Yeah.
Yun. So, yun, mga ka-IH, no? Wow, it's been a enlightening, grabe talaga yung natin. So, this afternoon, this conversation. And we are so grateful for them that for sharing their stories to us. And I hope sa inyo din, you can, for those, medyo may nakita kong comment kanina na medyo nasayangan siya, na late daw siya. This can be replayed. Just visit the Facebook page of In Harmony TV. So In Harmony, and you can watch it, and then you can also share it also, because our intention is that we would be able to properly educate our mga ka-harmony para na din ma-dispel na yung misinformation. At the same time, medyo matanggal-tanggal na rin siya yung ating mga anxiety, ang mga fear of the unknown. Now, moving on sa atin, no? Our next episodes would be, we will have a series of webinar by Dr. Dale Pasco. He's a surgeon, okay? But at the same time, he's also an expert on natural and lifestyle medicine, plant-based medicine. You heard kanina si Richelle na nagsabi na contributing, she considers the vegetables as part of nakatulong sa kanya para ma-recover siya. So this Saturday will be the beginning of our webinar, and let's try to understand ano ba talaga yung gamit ng steam inhalation, yung tuob sa COVID-19. Ano ba? If you have questions to that, kasi medyo debatable to Nasabing hindi yan siya ba dapat, meron na yung sabing pwede yan siyang gamitin. Session 2 would be about hot fermentation for COVID-19, and the session 3 is just G-Steward. This is happening every Saturday, starting this Saturday at 2 o'clock in the afternoon. You may check our page. You may please register, because we will be inviting 2 participants per episode, 2 registrants who will join us in the StreamYard para you would have an up-close engagement with Dr. Dale, and you can personally ask him the questions that you need to clarify. So please don't forget on that. This Saturday, we'll start the webinar series on lifestyle medicine by Dr. Dale Pasco. So don't forget, check the page for that. All right, so yun, we'll be seeing you again this Saturday, and then Wednesday we have a special episode that would be by Dr. Sara Namoko, and we'll talk about the importance of research sa ating mga day-to-day transactions. Hindi lang po siya ang research pang academic, meron din po siyang gamit sa ating sa ating buhay-buhay. So again, let us always remember that God provides. All we have to do is just have to know and communicate constantly with Him through prayers, and listen to that still small voice that guides us and guards us, especially in this time of pandemic. And we only have one earth. We have to care and share. Let's live in harmony, and we do that by keeping our conversation going. This has been Angel Lascuna Cullera. Thanking you all for joining us this afternoon. May pa-shoutout pala, pahabol, pa-shoutout. Sabi ng husband ko dyan, ng technical. Shoutout dyan sa Lumbia National High School, our Sir Secretaria, Ma'am Farida, Ma'am Ragmak, and Sir Pael at Lumbia National High School. And of course, to Dr. Maria Cristina Ganas. Hello, Madam Principal. And good afternoon. Have a great week ahead of you. And always take care. See you again this Saturday. See ya!